I walked out of my GP surgery holding 6 prescriptions and I knew something had to change. I'm Neil. For 13 years, my medication list grew longer whilst my health got worse. In the next 4 minutes, the conversation that stopped me, the question my GP asked, and the appointment that was in October 2023. 6 prescriptions isn't unusual. Let me be clear about that. For someone with my profile, elevated cholesterol since 2012, gout since the late 90s, asthma since 1978, borderline pre-diabetes by 2022, 6 prescriptions is actually quite good management. Well, it looks like it. 1 medication per condition, evidence-based each one. Statins reduce cardiovascular events in high-risk patients. Alpurinol controls uric acid. Inhalers keep airways open. Antihistamines reduce allergic response. None of this is reckless medicine. This is the NHS doing what the NHS is designed to do. The myth isn't that the prescriptions were wrong. The myth is what I believed about them. I believed that managed meant improving, that taking the medication meant the condition was being addressed, that 6 prescriptions meant 6 problems being solved. 13 years of blood tests will tell you whether that was true. Let me take you through the timeline, not selectively, all of it. April 2012, first blood test that flagged cholesterol. Total cholesterol 7.5. Triglycerides 3.4. Outside the reference range, GP note on the results, needs to speak to the doctor. That was the start of the statin conversation. So statins began. Atorvastatin, 40 milligrams daily. The logic was sound. Lower the cholesterol, lower the cardiovascular risk, standard. October 2016, 4 years on, total cholesterol 7, not down, essentially the same ratio, 4.8. Triglycerides still outside reference range. HbA1c 40, borderline pre-diabetic. The GP added ezetimibe, dual cholesterol therapy now, both medications daily. August 2020, 8 years in. This is where I want you to look at the numbers properly. HbA1c 43.2. That's the pre-diabetic range, consistent with pre-diabetic hyperglycemia. According to the GP notes, cholesterol 7.3, non-HDL cholesterol 6.07, flagged abnormal, triglycerides 2.5, urate 502, high, outside the reference range, on alpurinol. On dual cholesterol medication, cholesterol 7.3. December 2023, 11 years on statins. This was the last blood test before everything changed. Total cholesterol 8, LDL 5.2, cholesterol HDL ratio 6.2, above target. HbA1c 46, 1 point from a diabetes diagnosis. Oh, that's my liver enzyme, 69. Reference range is under 40. My liver was running at 173% of the upper limit. 6 prescriptions, 11 years, cholesterol higher than when I started the medication. The GP's exact words at that appointment, logged in my records, everything looks fine, stay on your medications. I was 18 stone, pre-diabetic, liver stressed, and everything was fine. October 2023, I moved, left the Isle of Wight, and left my surgery. All my prescriptions ended on October 31st when I was deducted from that practice's list. I registered at my new surgery in December 2023. New patient, new area, new GP. And somewhere in the middle of February 2024, I ran out. Not a dramatic decision, not a conversation, no medical sign-off. The medicine box was just a bit empty. And I sat there looking at it, 13 years of blood tests and a folder on the desk, and I made a call. I stopped everything. All 6. Middle of February 2024. My own decision. I need to be straight with you about this because it matters. I'm not presenting that as a template. I'm not recommending that you do what I did. Running out of medication and deciding not to renew is not something I recommend. It's one bloke with 13 years of data making a unilateral decision that could have gone badly wrong. It didn't, but it could have. What I did next was tell my GP at the new surgery what had happened. We arranged blood tests, we monitored. That monitoring is what produced the data I'm about to show you. If you're on medication and curious about your own numbers, the conversation to have is with your GP, not instead of them, with them before you do anything. March 2024, 1 month off all medication. The ALT, the liver enzyme that had been running at 69, came back at 28, inside the reference range for the first time in years. 1 month cholesterol, 7, down from 8. EGFR, kidney function, came back at over 90. That's excellent range. My GP looked at those results and said, This is better than on statins. January 2025, 11 months off all medication. HbA1c, 40, back to normal range. December 2023, on all medications, 46, pre-diabetic. 11 months later, on nothing, 40, normal. ALT, 29. Kidney function, still over 90. April 2025, 14 months off all medication. HbA1c, 37, optimal. The lowest reading in 13 years of blood tests. CRP, that's the systemic inflammation marker, dropped from 6.2 to 1, an 84% reduction. ALT 23, November 2025, 21 months off all medications. My ALT was 10. That's 86% below the reading it was in December 2023 when I was on dual cholesterol medication. Cholesterol 6.77, triglycerides 1.4, normalised, inside the reference range. HbA1c 37, still optimal. EGFR still over 90. No asthma inhaler use since February 2024. I had 2 uses of the preventer, both times around my stepdaughter's long-haired dachshund. No gout flares since stopping alpurinol, not one. 20 months. No allergic reactions that required cetirizine. 6 prescriptions, 0 taken. 21 months of NHS blood tests to show what happened. 13 years of NHS blood tests, the actual numbers, the GP conversations, what changed and what didn't. If you want to follow someone who documents this properly rather than just talks about it, that's what this channel is. Subscribe if it's useful to you. What my data suggests, and it's one person's data, 13 years of it, but only one person, is that in my case, the medications were managing numbers without addressing whatever was driving them. When I changed what I ate, when I ate, and how I moved, the numbers shifted. Not instantly, not perfectly, but in a direction that 11 years of medication hadn't managed. That's not an anti-medication argument, it's an observation from one set of blood tests. This does not mean everyone should stop the statins. If you have a family history of cardiovascular disease, if you've had a cardiac event, if your GP has assessed your 10-year risk and determined medication is indicated, that is a different clinical picture to me. The Q-RISK-2 score on my April 2025 records came back at 7.28%. That's a relatively low 10-year cardiovascular risk. The calculation for someone with a history of heart attacks looks entirely different. Medication works for the conditions it's designed to treat. My data doesn't change that. If you're not on 6 prescriptions, if you're at the stage where your GP has said your numbers are something to watch, let's keep an eye on it, this pattern might be worth understanding before that conversation becomes a prescription conversation. Sorting your food, your eating window, your sleep, that work happens before the medication discussion, or it happens alongside it. The earlier, the better. I stopped 6 medications without medical supervision. My results improved. That is not an instruction. Never stop or change medication without your GP's involvement. What I did carried risk. I got lucky with the outcomes. You deserve better odds than luck, which means a GP conversation before you change anything. If you want to understand what's changed in my diet and fasting approach, what actually drove those biomarker shifts, the 7-day fasting blueprint is a free download. Links in the description. 13 years of data informed it. And a serious note before you go, this video is educational content only. It is not medical advice. I stopped 6 medications without GP supervision. I've told you that honestly because I think you deserve the honest version. Please don't replicate that decision. Speak to your GP before changing your fasting pattern, your diet, or your medication. New videos every Monday, Wednesday, and Friday.